Imagine walking into a clinic and it sounded like this. Everyone is speaking a language you can't understand. You are in pain, but you don't know how to tell the doctors where the pain is. This is the reality for countless individuals living in America.
Every year in the United States, communication failures contribute to over $1.7 billion in malpractice costs. National data from Controlled Risk Insurance Company shows that miscommunication remains one of the most persistent and expensive breakdowns in modern care. Health equity and patient experience are no longer just goals to aspire to. They now directly affect how hospitals get paid, their risk of lawsuits, and their public ratings. This gap creates a significant market opportunity. The U.S. healthcare industry exceeds $4 trillion annually, with over 300 million Americans dependent on healthcare infrastructure that still doesn't systematically capture patient communication and cultural needs before appointments. Providers enter exam rooms clinically informed but culturally blind. Care becomes reactive rather than prepared.
But what if this barrier could be broken before it even went up? My name is Mahiti.
And my name is Isha.
And this is Cultura, a pre-visit cultural intelligence platform that transforms cultural context into core clinical input.
Here's how it works. Before an appointment, patients receive a secure text from their clinic linking to a brief mobile form. In 3 minutes, they identify high-impact needs such as language support, gender preferences, cultural considerations, communication style, anxiety triggers, and optional prior healthcare concerns. After submission, the system uses their responses to recommend providers whose expertise and care style best align with their needs and preferences.
On the clinician side, this information remains confidential and is ethically processed using existing AI summarization technology to generate a concise, one-screen summary embedded directly into the patient's electronic healthcare records. The clinic can view recommended providers for each patient based on their identified needs, helping guide referrals and care coordination. No additional logins, no workflow disruptions, no new systems. So by the time the provider enters the room, the guesswork is gone.
The market potential for Cultura is substantial. We will begin with immigrants serving outpatient clinics and primary care networks, where communication gaps are most susceptible. These clinics face financial penalties tied to readmissions, malpractice exposure, and patient satisfaction metrics. Cultura reduces preventable harm while improving efficiency, without extending visit time. Our revenue model is simple and scalable. Clinics pay a per-provider monthly subscription fee of $200, structured to cost significantly less than a single preventable malpractice claim or repeat visit.
Because Cultura integrates across existing EHR platforms using API-based compatibility, in the future it can scale across hospital networks, urgent care systems, and telehealth providers without infrastructure redesign.
Moreover, the current healthcare information system is a red ocean, crowded with fragmented, inefficient solutions that only partially address language and cultural barriers. Most clinics rely on costly, inconsistent ad hoc interpreters, generic translation apps, or complex staff training programs that disrupt workflows without fully preventing miscommunication.
What makes Cultura a true blue ocean innovation is that we are not competing with interpreter services, translation apps, or cultural competency training programs. Those solutions are reactive and fragmented. Cultura redefines cultural preparedness as proactive, embedded, and standardized. Instead of improving intake forms, we create a new category: cultural context as clinical input. We eliminate reactive interpretation and fragmented communication. We reduce preventable harm, malpractice risk, and provider burnout. We raise safety, trust, efficiency, and clinician preparedness. And we create a new standard of care, where cultural understanding is embedded before the patient enters the room.
To date, we have incorporated direct provider feedback, including insights from the CEO of Austin Regional Clinic, to develop AI-driven patient-provider matching that makes cultural alignment not just informational, but actionable. With the connections we have made, we are currently seeking funding to finalize EHR integrations, complete compliance certifications, and pilot implementation across community clinics. The technology required already exists: secure patient texting systems, AI summarization tools that are in compliance with HIPAA regulations, and EHR integration APIs. The implementation of Cultura is both feasible and cost-effective. From there, Cultura can adapt across regions and healthcare systems to support diverse populations worldwide.
As value-based care models continue to tie reimbursement to patient outcomes and satisfaction, culturally prepared care will become a competitive necessity, not an option. Ultimately, Cultura is not just a tool. It is infrastructure for safer healthcare. Because the first time you step into a clinic should begin with trust, not confusion.